Yes, okay. Thank you.
Good morning, everyone. My name is Jessica Engle. Thank you so much for joining me today. I'm very excited to be here. I am a physiatrist who specializes in cancer rehab, and I work at Johns Hopkins. And today I'll be speaking about exercise throughout the cancer care continuum. This is our number for appointments in case anyone needed it or to contact me, and this is my email as well. Before I got too in-depth, I just wanted to remind everyone that the Livestrong program at the YMCA actually has a reduced rate program where those cancer survivors could join for a reduced rate. It's different in different parts of the country, different YMCAs, not every YMCA has it. But additional fitness clubs also have similar programs, and also there's a Silver Sneakers program, and sometimes various different organizations will also have free or reduced programs worked out as well. So a lot of you probably have not heard of physical medicine and rehab before, or physiatry. I know I hadn't until I was deep into medical school, and it's a branch of medicine that aims to enhance and restore functional ability and quality of life for those with physical impairments or disabilities affecting the brain, spinal cord, nerves, bones, joints, ligaments, muscles, and tendons. And unlike other medical specialties that focus on medical cure, the goals of a physiatrist are to maximize patients' independence and activities of daily living and improve quality of life. Physiatrists are experts in comprehensive patient-centered treatment plans that are integral to members of the care team, and they utilize cutting-edge as well as time-tested treatments to maximize function and quality of life for their patients. And right now, Johns Hopkins has various centers throughout the DC and Maryland area. So I kind of see myself as this very high-tech graph that I made, this very high-tech chart, that I'm a piece of the puzzle where the cancer patient and the family are in the center, and we work with the oncologists, supportive care teams, nursing, social work, spiritual care, and various other branches to help come up with a holistic plan to treat the whole patient. And we just use the physiatry tools in our toolbox to treat the cancer patient. Now, in 2015, there were 1.6 million new cases of cancer in the United States. And at that time, there were 14.5 million cancer survivors in the United States. And this was thought to be due to earlier detection, improved treatments, and prognosis. And the 5-year relative survival rate continues to increase as compared to, for example, we look at the 1970s. And we tend to see more cancer diagnoses in patients that are 55 years or older, and this is just expected to grow with time. And if we looked at 2012, 59% of cancer survivors were greater than 65 years old. And cancer is sometimes associated with aging because there are unique challenges for risk for recurrent or secondary cancers, risk for chronic diseases, long-term impairments, and compromised quality of life that we have to keep in mind. Dr. Randy Pausch, who wrote a book called, and a speech called The Last Lecture, stated that we cannot change the cards we are dealt, just how we play the hand. And I think cancer rehab tries to do that and help throughout the cancer oncology, the oncology continuum, and to maintain or restore function, reduce symptom burden, maximize independence, and improve quality of life. And I'm one of the few fellowship-trained cancer rehab physiatrists in the country, and I work on identifying, diagnosing, and the treatment of cancer-related impairments using a patient-centered and goal-oriented approach. And we use various forms of treatment, such as lifestyle modifications, sometimes medications, sometimes osteopathic treatment techniques, sometimes injections, sometimes therapies as well. And a lot of times I get asked, when should a patient be referred to cancer rehabilitation? And I think the big answer is, has your function changed? Patients should be referred to cancer rehabilitation professionals if you see that there's been a change in function, you're having difficulty with activities of daily living. Activities of daily living are things like getting dressed, bathing, being able to eat, getting on and off the toilet. If new impairments arise, sometimes all of a sudden you have back pain that wasn't there before, Or maybe you had an old car accident and now the back pain's coming back. Or old impairments worsen, such as maybe an old football injury from high school that didn't bother you for decades and now is a problem. Sometimes we see a phenomenon in cancer patients where they have a decreased muscle mass, and that's also common in androgen deprivation therapy, where maybe you started off with a lot of muscle and in a short period of time due to the therapy you'll notice a decrease in muscle mass, and that can affect your muscles and joints. There's a great need for rehabilitation. Dr. Andrew Chabelle did a study and found 530 impairments and 92% required physical rehabilitation intervention. And if these impairments were identified while a patient was in the hospital, they were more likely to get treatment. Common symptoms that we see in cancer patients include fatigue, insomnia, cognitive dysfunction, depression, but many others, such as anorexia, pain, constipation, shortness of breath, nausea, dry mouth, numbness, tingling, and dizziness. In cancer rehab, we can look at various impairments such as balance issues. I'm a big proponent of looking at balance issues and working on balance because we want to try to prevent falls and try to prevent other injuries. We can look at patients that have had weight loss, weakness, decreased range of motion, trouble opening their jaw, decreased muscle mass from steroids, impaired activities of daily living, like it's harder to get dressed, it's harder to urinate or have a bowel movement, trouble walking, spinal cord injuries, fatigue, neuropathy, sometimes numbness and tingling, or a burning sensation in your fingers or your toes. And we can help with people that are having trouble getting on the table, staying on the table, or getting into position for radiation therapy. And various other treatment side effects we can help with such as androgen deprivation therapy side effects. We can help with pre-existing neuromuscular or musculoskeletal conditions such as arthritis, bursitis, tendinitis, back pain, muscle pain, radiation fibrosis, and sometimes end-of-life concerns and family training. And the coloring didn't come out well on the bottom, but Dr. Tulgawand noted that we've been wrong about what our job is in medicine. We think our job is to ensure health and survival, but really it is larger than that. It is to enable well-being. So with that, I want everyone to just start for a moment and stand up. Just shake it out for a second. Try to do a big stretch. Can everyone take their hands like this and see if they can clap their hands in the middle? Okay, that's important. Good. All right, meet your neighbor if you haven't already.
How do you do?
Okay. And we're actually going to work on, you can sit back down, we're going to work on a breathing exercise. So, this is this is the real life human doing it, but if you could sit at the edge of your chair and place one hand on top of your chest and the other hand where like your diaphragm is, or the big muscle of breathing. And what you're going to do is take a deep breath in, and you're going to try to feel this bottom hand try to move out. So it should be kind of like this. And you shouldn't feel any movement in your chest as you breathe. You should try to focus on your belly. So take a deep breath in and feel your belly come out and out. So, and it helps to work on the muscles in between and try to help move the lymphatics and help with breathing. So try that one more time. Take a deep breath in and out. And really focus on moving everything from your belly. So years ago, if you had pretty much any ailment, everyone was prescribing bed rest. Just lay down for a few days, weeks, months, and see if you get better. But we've learned a lot from then, that most of the time bed rest is not best. If you rest, you rust. So there are times when you should avoid exercise or call your doctor, such as if you have a new rapid heart rate, shortness of breath, or if they specifically say maybe you have some sort of impairment where you have to have bed rest. But most of the time, bed rest is not prescribed. So if you're currently exercising, keep at it. If you haven't been exercising in the past, tomorrow's a new day, or today's a new day, and you can start whenever you're ready. Now is the time, and I have a lot of evidence on that later on in my talk. Stretching should not cause pain, but take time off if there is skin breakdown or fragility with treatment, especially with radiation. Sometimes you can have some skin breakdown that just needs some time to heal, and you don't want to overdo it. So, Dr. Eichmeyer looked at the role of efficacy of exercise in persons with cancer and found that exercise can prevent cancer by promoting a healthy body weight, regulating hormones, decreasing processes that allow for cancer progression, controlling new blood vessels from forming, and decreasing inflammatory pathways, helping cells die when they're supposed to, improving cell replication process, altering tumor initiation pathways, and also improving reactive oxygen species mitigation, or like free radicals. And they did this study in, I believe it was Europe, where they looked at patients that were exercising during treatment. And they looked at a group of people that were in no exercise, a group that were in low intensity, and a group that was in high intensity. And they found that the people that were in the high intensity had to have the least amount of reductions in their treatment. So it was called the PACES study, Physical Exercise During Adjuvant Chemotherapy Effectiveness Study, and they looked at breast or colon cancer. Eventually, unfortunately, they didn't get enough colon cancer patients, so they just looked at breast cancer patients. And basically, there's a decreased need for chemotherapy dose reduction in patients participating in exercise. And it was most notable in the patients that did the higher intensity exercise. And another study looked at over 121 women from the Nurses' Health Study and showed that breast cancer patients who gain weight may have an adverse effect of treatment due to hormonal interplay. And they showed even walking could reduce death from disease. And the physical activity may reduce risk of death. Now, I might not necessarily be saying a study that was all prostate cancer patients, but we're trying to see if this works in every group, and most of the time it does. And we do have a lot of studies on cancer patients, particularly prostate cancer patients. So exercise after diagnosis decreases the risk of recurrence. Those who exercise have fewer side effects during and after treatment and improve sleep. It increases stamina, improves mood, and overall wellness and health are better. According to the American Cancer Society, exercising after one is diagnosed with cancer lowers the risk of blood clots and increases blood flow to the legs, decreases the risk of heart disease, prevents muscle wasting, decreases nausea, and helps for a better quality of life. Also, physical abilities can be improved or maintained. It lowers the risk of osteoporosis, decrease the risk of fall, and lowers the risk of broken bones. Can help control weight, lower the risk of depression, increase your ability to become more increase your ability to be more independent, decreases fatigue, allows you to keep social contacts, lower risk of anxiety, and self-esteem may improve. But always check with your healthcare professional prior to engaging in an exercise program. Stretching should not hurt. Take time off if there's skin breakdown, pain, fragility, or treatment. Ask your healthcare professional if lymphedema garments are needed, if you have lymphedema, which sometimes happens. And then we have special precautions. For example, if someone has neuropathy, if someone has a metastasis or a bone lesion, if someone has osteoporosis, we have special precautions. And these are just guidelines. We need to kind of cater everything to each individual patient. So your ability to exercise can vary on your type of cancer, the location. Restrictions may present due to radiation, to drains, after maybe a surgery, someone has a drain, wounds, incisions, bone lesions, the treatment of the cancer, and the fitness and endurance levels and strength. If you have new pain, report your new bone pain to your healthcare professional. Certain precautions we have to think about are blood counts. Sometimes we might be a little bit limited with anemia or low hemoglobin, electrolyte levels, white blood cell counts, platelets. At certain times, and especially during treatment, sometimes people can have lower blood counts and might need to avoid things like public gyms or public swimming pools during that time. Talk to your doctor first. Drink plenty of fluids if you're able, because you could become dehydrated, especially if you're not drinking enough to begin with. So, but if you're moving around and the gym is warm and the pool is warm and you're exerting yourself more, make sure you're getting enough fluid, and take a break, especially if you're dizzy or feel like you're dehydrated. Go slow. Report all new pain concerning symptoms and see your healthcare professional. And you want to also watch for bleeding, especially if you're on blood thinners or bruising. And you want to avoid resistance area exercises if you have a line or tube in that area. So if you have like a PICC line, you maybe not want to be doing resistance exercises. Neuropathy may cause difficulty with certain exercises and is best treated with healthcare supervision. So avoid dangerous things that are hard to balance on, like scooters. But neuropathy is something that we see quite frequently, and we can help patients with neuropathy in various ways, and we can also help have precautions and work on balance and things like that during therapy. Avoid uneven surfaces, especially if you have difficulty with balance or neuropathy. Talk to your surgeon and see if there's any precautions that you might have in particular. Sometimes it's best to avoid chlorine or swimming pools during radiation because the skin is really sensitive during radiation, and that can actually cause it to become more irritated.
Does that apply to like salt pools as well, or no?
It could also become irritating to salt pools as well because there is a small amount, and I don't know the exact ratio, but there is some chlorine in salt pools.
Okay.
So during active radiation or active skin breakdown, you should kind of put a pause on that. Report all leg swelling, shortness of breath to doctor at once. You try to do some exercise instead of no exercise. Light exercise in lieu of none is better than nothing. And you might need to avoid weightlifting if you have a bony lesion in that particular bone. So osteoporosis and osteopenia, or bone thinning, are something that we see more commonly with age, but can also see with androgen deprivation therapy. And so there can be an increased risk of osteopenia and osteoporosis. You might want to undergo a screening for osteoporosis or osteopenia, and typically that's something called a DEXA scan, which is kind of, it's pretty quick to do. People get them all the time. You would just need a prescription from your doctor. But resistance exercises, including weightlifting, are important at least twice a week, and that's something that's been further stressed in the most recent studies that have come out from the American College of Sports Medicine. Talk to your doctor about this, and occasionally we have to do some like vitamin supplementation or like calcium, vitamin D as well to promote bone health, but talk to your doctor because that's not necessarily for everyone. And we do recommend stretching, especially before and after radiation. Working on posture, balance is extremely important. Like I said, we want to try to prevent falls. And for those folks that have, lymphedema, avoid tight bands or ropes on that particular limb. And your activity level should be that you can talk to your neighbor, but not sing to them. So you want to be doing enough activity where you can have a light conversation, but couldn't, sing out Bohemian Rhapsody or something like that. And it's always best to start low and go slow. So do low weights at a low repetition. And set short-term goals. Start for at least 10 minutes at a time. Maybe you can look at your step counter, and if you're walking 3,000 steps now, maybe try to do 3,500 by the end of the week, and then slowly, boost it up from there. Take frequent rest breaks and short periods. After short periods of exercise, split it up. And work on the large muscle groups first. Things like your, your quadriceps or big muscle groups like that first. Warm up and cool down after exercise, and do things that you like. I mean, don't force yourself into a class or any type of exercise that's not for you. If you're not a runner, don't say, I'm gonna make myself run every day. There's so many different things that you could do. You could go swimming, you can, get outside and walk on a trail. There's ballet. I mean, there's so many different things. Be active when you have the most energy. Fresh air may be beneficial. Avoid exercise close to bedtime because it can actually make you stay up and have poor sleep. It can interrupt those rituals that you have at sleeping time. And exercise is easier if your symptoms are controlled. So if you have severe pain in an area, it's going to be kind of hard to exercise sometimes. So, or if you have severe nausea or something along those lines, they might get in the way. Gradually increase activity and try something new. So, and I don't think you should necessarily just do one thing. I think we should vary it, right? So when I was in school, I grew up in New York and a little bit north of New York City, and Evander Holyfield was a big boxing champion at that time. He came to the town where I lived and took ballet lessons, which I would have never expected at that time. But you have to think some of these more advanced athletes, if they're a great basketball player, they're not just gonna, run loops all the time and shoot baskets. They're gonna do a bunch of different things. They're gonna do weight training. They might work on, the cardiovascular fitness. They might be taking hikes. They might be doing, ballet. They might be doing yoga. There's so many different things you can try. Tai Chi and Qigong are beneficial with balance, and also help some people because there's a meditation quality to those as well. And then for the National Lymphedema Action Network position, just in case lymphedema applies to anyone in this room, there's a lower risk of lymphedema if healthy weight is maintained through exercise and diet. Avoid inactivity, which is not the last time you're going to hear me say that during this talk. So avoid prolonged sitting or prolonged standing or prolonged laying down. Rest frequently during activity to allow for recovery. Monitor at-risk areas for change in texture, shape, or size of tissue, soreness, firmness, heaviness, skin breakdown, pain, and/or lymphedema. Activity or exercise should increase at a gradual pace of intensity and duration, and they also recommend avoiding extreme heat or cold. So this exercise, I don't know if they have enough room, but works on what's called the latissimus dorsi. So that's what it's going to look like. So basically, when you're sitting up in the chair, you have your arms resting at your sides, and slowly bend your body to the side, lowering your arm towards the ground, and then returning to neutral, and then you can try it on the other side. And you want to make sure you don't bend forward or bend backward during this.
How far are you bending to the side?
Well, until you get a nice, but not too painful, pull. And hold it, and then you can come back, and then make sure you do both sides of your hip. So that's another one we can work on. That's just a seated exercise. I mean, you can even almost do this on a plane. So this is what I'm really excited about, because this came out in November, and it was the American College of Sports Medicine had this huge group get together in, I think it was, I can't remember if it's San Francisco or San Diego, and they got together and they decided to talk about cancer and exercise. And they met for a while, and it was these big people in their field, and they got together and said, we met in 2010, we had this consensus then, we said you need to do this 150 minutes of aerobic activity each week, and on 2 of those days at least, do some resistance training, okay? And yeah, stretch every day. But let's try to really hone down on this and get some more information and figure out what's best. So they came out with 3 big papers that were released in November, and they kind of tweaked it a little bit. And they said, well, how long should we be doing this for? We didn't give a timeline on it before. So now they're saying at least 8 to 12 weeks, and to do moderate intensity aerobic training at least 3 times a week for at least 30 minutes. So that when you do 3 times 30, that actually comes to 90 minutes instead of the 150. And moderate intensity, like we described before, means you could talk, but you can't sing to your neighbor. And then also do resistance training as well as aerobic training at least 2 times a week. And then they gave you 2 sets of 8 to 15 repetitions. At least 60% of 1 repetition maximum appears to result in similar benefits. So they really tweaked it quite a bit and really drilled down on what was important. Plus they came out with this chart. So this is supposed to be for exercise for cancer prevention and treatment. So now they're actually using exercise as a form with everything else of treatment. And there's a lot less side effects than you would think to exercise. You might be sore, you might have to, get a pair of sneakers or something like that, so there's that cost part. But incorporating this in addition to your treatment, not in lieu of your treatment, in addition to your treatment, they thought that once they looked at all the evidence, they looked at tons of papers and tons of high-level evidence, that exercise for cancer prevention and treatment could help prevent and treat colon cancer, stomach cancer, esophageal cancer, bladder cancer, breast cancer, endometrial cancer. And then exercising during and after cancer treatment decreases fatigue, anxiety and depression, improves physical functioning, quality of life, and does not exacerbate lymphedema. For cancer survivors, incorporate exercise to improve survival after a diagnosis of breast, colon, and prostate cancer is on the bottom. So one of the papers, this is one I was talking about first, was the Kimmel paper. And then this is the one that was the Patel paper from the American College of Sports Medicine Roundtable on Physical Activity, Sedentary Behavior, and Cancer Prevention and Control. It says that exercise is a modifiable behavior risk factor. You can't change your age, you can't change your sex. Like a modifiable risk factor is, for example, you could stop smoking. Same thing with exercise, you could start exercising. And physical activity prevents colon, breast, bladder, kidney, stomach, esophageal, and endometrial cancers. Decreasing sedentary behaviors lowers the risk of colon, endometrial, and lung cancer. So that means things like parking at a further away parking spot, using the stairs instead of the elevator, taking 5 minutes of your lunch break and walking a loop around the office, and improve survival from exercising before and after a cancer diagnosis. And also reinforce that cardiovascular disease is actually the #1 cause of death in the United States. And increased sitting time is associated with 30% higher risk of colon cancer. And exercising before diagnosis is associated with a 23% lower colon cancer mortality rate, and post-diagnosis physical activity appears to have greatest influence on outcomes of cancer. So exercising after you're diagnosed appears to have the greatest outcome from what they looked at. And they also said that with prostate cancer, which is coming up. Being physically active is one of the most important steps for people of all ages and abilities that can take for cancer prevention, treatment, and control. And this is the study by Kimmel and her colleagues. It says exercise guidelines for cancer survivors, consensus statement from International Multidisciplinary Roundtable. Every survivor should avoid inactivity. Exercise can improve fatigue, physical function, health-related quality of life, I accidentally wrote fatigue twice, anxiety, and depression. It's generally safe as well as well-tolerated. And again, moderate intensity combined aerobic plus resistance training sessions performed 3 times a week and 2 times weekly of moderate intensity resistance training may also be effective in the latter, particularly in prostate cancer. So that's very important. And then another article that came, this is the 3rd article that came out of the roundtable, the big group that got together, was exercise is medicine in oncology, engaging clinicians to help patients and try to talk to oncologists and other physicians on how we can help patients. And exercise lowers the risk of developing cancer and improves survival after diagnosis. And prostate cancer applies even after diagnosis, and there's very strong evidence of this. And avoid inactivity, and it recommends up to 30 minutes of moderate intensity aerobic activity 3 times a week, and up to 20 to 30 minutes of resistance exercise 2 times a week. And so I wanted to talk a little bit about how we treat the whole person. And we look at things like nutrition, sleep, mindfulness, physical activity, and exercise. So we're trying to look at the whole person and look at various habits. So for example, Mr. Belushi here is smoking a cigarette, and that's a modifiable risk factor. I don't know if people remember this from, I think, the 76 Olympics. He claimed that he was eating little chocolate donuts and not really training. He was just going to go to the Olympics. But like going to the Olympics or competing in a large athletic event, cancer can be a marathon for some people, and you want to be as strong as possible. So if you had a choice between Mr. Belushi and this over here, which is a high-protein oatmeal, I think that the oatmeal is a better breakfast than the chocolate donuts, but it's important to think about the whole person, to work on sleep. Between the time of cancer diagnosis and the beginning of acute treatment, it includes physical, psychological assessments to establish a baseline function, identifies impairments, and provides targeted interventions that improve a patient's health to reduce the incidence and the severity of current and future impairments. The primary goal of rehabilitation is to prevent or reduce the severity of anticipated treatment-related impairments that may cause significant disability. So ideally, and we try to get at this point, any point along the way, is if a patient's diagnosed with cancer, and maybe they have to undergo radiation, maybe they have to undergo chemo or immunotherapy, or perhaps they're even undergoing something like surgery, how can we optimize the patient to get them as functional as possible prior to that intervention? So this might mean something like a nutritional intervention, to talk about a balanced diet. This might also include things like physical therapy or being taught an exercise regimen to maybe perhaps someone has impaired balance, which we see more than you believe, and trying to help with that, or they have weakness in their hips or something like that to be optimal as possible prior to undergoing this next step, this chemo or this radiation or surgery, or maybe all of the above. And Dr. Silver and her team defined rehabilitation as the beginning of the rehabilitation care continuum, during which there may be an opportunity to obtain a baseline status, identify pre-treatment impairments, improve physical and emotional health before treatment, reduce treatment-related morbidity and or mortality, decrease length of hospital stay and or readmissions, increase available treatment options for patients who would not otherwise be candidates, and quickly facilitate return of patients to the highest level of function possible. So, I just want to speak a little bit about fatigue. So the NCCN guidelines define fatigue as a cancer-related fatigue is a distressing, persistent, subjective sense of physical, emotional, and or cognitive tiredness or exhaustion related to cancer treatment that is not proportional to recent activity and interferes with usual functioning. Exercise can help treat fatigue, and this is an unknown quote, but I've heard patients say things that are very similar. I feel like I am already tired tomorrow. And fatigue can wax and wane. Sometimes you'll have good days, sometimes you'll have bad days, sometimes you'll have good parts of days, and then sometimes you'll be overwhelmed with fatigue after participating in a specific event or a certain function. We believe that fatigue is underreported, undertreated, underdiagnosed. It's probably a very, 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 very common symptom in patients. Probably over 80% of patients receiving treatment, and it may last hours, days, months, or even years after treatment. can alter quality of life and can cause a lot of distress. Some people say this causes more distress than pain, because at least there's a whole, the pain is, some people say the pain is the fifth vital sign. And so people are always asking about pain. Where's your pain? How much pain do you have? And there are multiple medications to treat it. But fatigue is not something that's sometimes as well addressed. So think about energy conservation or pacing yourself. You don't have to do that huge stack of dishes all at once. I promise you, if you walk away, the dishes will still be there when you get back. Or think about maybe sitting down during some of the activities. Learn to pace yourself, considering breaking up household activities into small chores or small intervals. Sitting down, do activities that require more energy when you have most energy. If you're exhausted at the end of the night, don't say, oh, okay, well now I'm gonna do all these things, I have to check this off my list, because it's actually probably gonna make you even more tired than you would have been, and you might even feel the impact the next day. You can consider things like assistive devices, helping putting things in the cart so they're easier to carry instead of lugging huge things around. And consider spreading activities out during the week. Do a little and rest of it. Consider the energy cost of everything and time to recoup. There are things like assistive devices. Bathing and dressing are actually a lot of energy. So some people will choose to get like a shower chair or a tub bench to use in the shower with a handheld shower head to try to help with the energy conservation and also help with prevent fall risk. And there are things that you can use, like a long-handled sponge stick that you can get at any pharmacy, so you're not bending as much, to help as well. And there are things like the sock aid. Because a lot of people say, well, I can dress myself completely except for my socks. So it basically looks like a cup that's cut in half with a string attached to each side, and you put the sock on it on your lap, you throw it down to the ground, and then you help put your foot in it. And sometimes occupational therapists, they are great. Activities of daily living, like getting dressed, bathing, that is their, that's totally in their wheelhouse, and they're great at different devices and ideas to help improve help with energy conservation and perhaps improve your energy level. And you have to remember you have an energy bank, so you have to plan, prioritize, and pace yourself. Only do things that make you happy and really that you love. You don't have to do everything. You don't have to go everywhere. So this is an example I saw of a fatigue scale, 0 to 10. 0 is no fatigue, 10 is the worst ever, which means you're just passed out in an office chair apparently, because you could just fall asleep anywhere. So I tend to ask patients that I see, what is your typical day like? What is your routine like? When do you go to bed? Do you fall asleep right away? When do you wake up in the middle of the night? When do you wake up in the day? Do you take any naps? How long are the naps? And also, what's your fatigue level? What makes it better? What makes it worse? So there are different strategies we have. Physical activity is one of them, and as it was proven, especially again with the big consensus of the papers they released last year in November. Physical activity, so maintain activity level or initiate an exercise program. You might feel more tired at first, but typically within a few weeks it does improve. Monitor your own fatigue levels, consider distractions such as socializing, games, family, friends, pets help as well. Make your interactions meaningful. Structured daily routines are helpful, and set priorities. Do things that really mean something to you. You don't have to go to everything. Have realistic expectations, pace yourself. Use helpful reminders. Sometimes people will use their smart device to say, hey, remind me to pick up so-and-so from school and things like that for fatigue, so that they don't forget, or set timers of, this can be their nap time. Do one thing at a time. There are ergonomic and assistive devices. Limit your naps. Depending on what you read, it says you shouldn't nap more than 20 to 60 minutes, because after that it can interrupt your sleep. And you also don't want to nap too late in the day. Don't overdo it. Delegate tasks. Complete activities when you have the most energy. Postpone non-essentials, and use technology to your advantage and go outside. Physical activities and exercise can help. Cardiovascular and weightlifting programs can help. Rehab referrals, psychosocial interventions such as cognitive behavioral therapy. There's also a great app for sleep that came out. It's free. It's done by, I believe, Stanford and the VA, and it's called CBTI, or Cognitive Behavioral Therapy, and -I, and it's for those that are having trouble getting to sleep, and it's free, and it's there's apparently been some evidence on that it works, so it's helpful. Journaling can help, support groups can help, and mindfulness. Sometimes people benefit from nutrition, bright white light therapy in the morning. Massage can help, yoga can help, some people say acupuncture can help as well. Having a sleep routine and sleep hygiene. So you shouldn't be texting in your bed, you shouldn't be watching movies in your bed, you shouldn't be in a computer on your bed. The bed is not for time traveling or whatever they did in bed knobs and broomsticks. The bed is only for sex and for sleep. So before I go into the next part, I also want to remind everyone here that another exercise, which I didn't speak about much today, is pelvic floor therapy. And sexual activity is an activity of daily living. And so there are various therapists that can help with pelvic floor therapy that can help for incontinence of both urine and stool, and that's something to think about. There are a lot of different pelvic floor therapists in different parts of the United States, and it's something to think about as well. It's not 100% exercise, but I just want to throw that plug in here. So this one is going to be a shoulder shrug. So it's basically, kind of pulling your arms back from a seated position. And you're going to squeeze your shoulder blades together and downwards, then relax and repeat. And you want to keep the rest of your arms and shoulders relaxed and make sure to focus on the movement of those shoulder blades in the back. So if I don't know anyone wants to try that, or just kind of and then relax. You can try it again. And that's all I have because I wanted to leave some time for questions. And that's my email address if anyone has anything they want to email me or any questions. And that's another number to call for questions. No questions? That was first. So I think the take-home points are some activity is better than no activity, even if it's parking further away, if you're going to the grocery store or something like that. And that there has been shown a benefit to doing activity after a cancer diagnosis in cancer survivors, and it helps improve symptoms as well. So, and do what you like.